Good afternoon. And today we have an honor of interviewing Sleep Tech Talk, the podcast related to sleep and mostly tailored for sleep technicians. That profession I really admire, and I think it has a lot of future and potential, and especially in relationship with the dentistry. And again, thank you to our audience. If you have trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can spread the word about our channel. If you're medical professional, this program would be really good for you, because we're gonna delve into the world of sleep technology. And most important, we're trying to build a community. In this particular program, it would be between sleep technicians and dentists to help patients to sleep better and educate them about possibilities. And we're all so passionate about. So good afternoon, Robert, Jerry, and Emerson.
Good afternoon.
And I'm going to give a little story how I find out about you. First of all, yes, it's a word of mouth, and I'm working with the companies some of you involved with, and they mention about, and I thought, oh my God, it's so interesting what now, sleep technicians, the people, I would say, a bit isolated areas, sleep technicians work at night, but you help to create a community for sleep technicians, what they feel kind of together, and they can listen and share some thoughts. So I thought it's great, and that's why I brought you to the channel. But my particular interest, and I think that's the missing link to help people to sleep better, I think it has to be so much more collaboration between the dentists and sleep technicians on the both end. It has to be reciprocal, mutual relationship. So my first question, how did you come up with that great idea of having Sleep Tech Talk podcast?
Thank you so much for allowing us to join you today for your podcast. I will take the response to this question, but I would say it was probably 2.5 years ago now, or somewhere in that neighborhood. I had this idea that as I looked around at the different podcasts that were available in the industry related to sleep, I felt like that there was a segment that was missing, and that is related to sleep techs. And knowing that myself and my colleagues here, number one, we all worked together at Respironics at one point, and our background involves us, at one point, actually performing sleep studies. So I felt like that, these were the two guys that I needed to pull together to put a podcast in place, and I reached out. They were interested, and we're, we've been going for a while now.
No, I think that's such a great idea. And I would like to ask you, how do you envision, that's the hottest question for today, envision the collaboration between sleep technology world and dentistry to improve accessibility to sleep health? Because constantly, I'm going to share with my audience my own travels. As a dentist, we do have opportunity to educate our patients. We do see a lot of signs of sleep breathing disorders. And at least it seems to me what my team doing such a great job educating patients. But then once patients leave the office, magic happened, and we see this patient in 3 months with nothing done, in 6 months, whatever time is. And I would like to see your point of view. How do you see what we should do to create a stronger community, stronger ties, stronger bonds between dentistry and sleep tech world?
Well, I think that the number one issue that we face is that for most sleep technologists, they live in a world where CPAP is the primary choice. And so you've got that variable, and it's kind of what we call system one thinking. It's comfortable, it's easy, it's all they've really known. And when we start talking about oral appliance therapy, sleep technologists and sleep physicians, for that matter, tend to think of it as a second option, an option after everything else fails, rather than a primary option. And what we know is that oral appliance therapy is as effective as CPAP and many of the outcome variables that we need to have. And so I think for sleep technology, what we need is for sleep dentistry to help educate the technologists so that they understand as they're communicating with the tech and they're educating that tech, they're able to convey how effective the therapy is, so that the patient is comfortable. They have to be comfortable so the patient can be comfortable, because at the end of the day, people take care of people and people trust people. So that's the key part of this is the technologist needs to have the same comfort level that you have in conveying that therapy and the success of it to the patient.
And I'm going to ask you a question, which I thought, or I think it should be the future of the education. I want to ask you about wearable technology. I noticed on your podcast, you talk a lot about wearable technology to, I would say, to get the great observations, to promote the education. Please tell me, when recommending wearable devices to patients to track sleep, what are specific device or features you find valuable or effective for that reason, for education, for making patients to understand?
Certainly. So I would say that on our particular podcast, we typically try to stay focused on the new technology, new equipment that helps to diagnose patients. But certainly there is a market today with things like the Apple Watch and the Circle Ring, which have had recent updates that allow them to be able to do some types of sleep tracking. That's certainly important in helping to screen patients, but is ultimately not available today to allow them to be diagnosed through that particular technology. So we're certainly advocates of using every tool available, and with that, those new wearables that are available in the marketplace, from a consumer standpoint, it certainly gives the patient the a little bit more information to take to their provider to help them to ultimately get diagnosed with whatever the issue might be.
So
And I was just going to say, just to piggyback on what Robert said right there, the big differentiation between the two is diagnosis versus screening. And what he talked about, those products that you can buy over the counter, they're more for the screening thing. And the other part, the ones that we typically feature on our show, are for diagnosis. And there's a big difference between the two.
Regarding the diagnosis, which technology you find most patient friendly?
Well, without a doubt, the home sleep apnea testing technology is patient friendly. Being able to test somebody in their home under normal circumstances is without a doubt the most comfortable position. The question really comes down to what is the technology that is accepted by the payer? What technology is accepted by the American Academy of Sleep Medicine as a viable, reliable technology that's approved and would also be approved by Medicare. And so that space becomes rather narrow, because I think when it comes to the wearables, we like easy. We love it to create access to care, and all of that's important. But when it comes down to it, I think it's important for the clinician to make sure they're using a technology that is approved by the Academy, that allows for that has been, like some of the people we've had on our show, one of the things they talk about is how those algorithms have been tested, how the data has been reported, it's been peer reviewed. And that's such an important part of this, is the technology that we're using to diagnose a patient been tested appropriately, that it's been peer reviewed, and it is a legitimate diagnostic technology. And I think that's so important in making sure that we test people appropriately.
Of course.
I would also add there that you can't always necessarily assume that what the manufacturer tells you is accurate information when it comes to some of these new technologies. That they may say that it's been approved and that it's it meets the FDA guidelines, but that may not necessarily be the case. So you have to be careful when you're looking at different technologies for diagnosis.
I'm going to ask you a very futuristic question. A lot of people, I'm not talking about sleep technologists, but a lot of people in general now with involvement of artificial intelligence, looking to reinvent themselves. And some people thinking about your field, sleep tech. And for somebody who already in the field, what do you think would be the future of this profession? What we foresee?
Well, I think that the future is very bright for sleep technology. The three of us are very invested in it. We believe that it's certainly something that's evolved a lot. When we all started, we were doing paper, we were doing attended studies. There were no computers involved. There was no AI. And clearly things changed, and innovation is never bloodless. There's always going to be change that has cost. But what we are seeing is the opportunity for sleep technologists to really move into the role of the clinical educator, the CCSH role, being able to help dentists to educate their patients and help them understand their journey to work inside a hospital. I know that Robert and I have worked a lot on inpatient screening programs and how important that is to reaching more patients. So I think the sleep technologist role, in my opinion, is really about creating better access to care. It's creating more education. It's really helping physicians and dentists reach more patients, educate more patients, test them and treat them. And that's a big gap. I think that's where the future lies, is filling in a lot of those spaces where both dentists and physicians need that collaborative help in being the arms and ears and eyes of those practices to reach patients.
No, that's so beautiful how you put it. I think it's such a noble role because yes, from 10 patients I see in a practice, 2.5 have some trouble sleeping, sleep and breathing disorders, and it's so visible. And I think, there are so many obstacles, but I think building the community between sleep technicians and dentists can encourage both ways, can encourage sleep technicians to offer more oral appliance therapy and in the same time to have more dentists involved. Because dentists are very isolating profession.
I think there's an important point there because, really today and sort of traditionally, sleep techs have been involved in the diagnosis process, not so much in the care management. But as we move forward to more of a precision type of sleep medicine where patients are going to get the therapy that is really the best form of therapy, no matter what that type of therapy is, that sleep techs can ultimately become involved in that care management piece and for the long term become involved in a patient's care versus just that initial entry into the diagnosis process.
And I think that's so. Just to add on to that is when you look at the future of where this is going, that part, what Robert just mentioned, is extremely huge. Is the fact that this is moving from just that initial part of the diagnostic piece of sleep to being more involved in the care management. We're looking at patient outcomes. How much better are they? How are they going to be 5 years, 10 years from now? How does it affect blood pressure? How does it affect their diabetes? And that's where the technologists will be involved in the future.
I think your words, my next question would be, if you have a magic wand, how can dentists bring the technician into the office?
I think that begins with the bridge building. I know dentists that have sleep techs that they've hired to be a part of the staff. I think that's one way. The other way is the dentist going to the sleep lab and educating the staff. The three of us used to sell masks for Respironics, and the way we educated techs on new masks is we went there, showed them how to use it, helped them fit it, and then they began using on their patients. I think dentists can do that. I think dental hygienists can help sleep techs understand the role of what they do. I think it's really about demystifying both sides of the relationship. I think that sleep technologists really need to understand what happens with an oral appliance, because I think for a lot of people in sleep medicine, an oral appliance has a one-dimensional process. It just moves the mandible forward. They don't understand the vertical opening that's important. They don't understand that, I think I heard it, for every millimeter you move forward, it's 3 millimeters, in the airway. So you've got some interesting things that happen that sleep technology doesn't even know about. So I think it's really important for sleep dentistry to begin to educate the technologists, bring them into the process, just like physicians have for the last 30 or 40 years. We need that to happen in sleep dentistry as well.
Thank you very much. I really appreciate your time. And I think what you're doing is going to help to bring future into the present. Thank you. What a wearable technology for patients to tracking sleep is there a specific device you find effective or valuable?
Yes. So I would want to mention for the sleep technology that could be used. There is a new device, a newer device called the Circle Plus Ring that is available. That is diagnostic, that allows for diagnosis and also allows for consumers to do their own sleep tracking.
How do you see a relationship between sleep technology and dentistry evolving in the coming years? And what advancement you're most excited about?
Well, I see the relationship just getting stronger and stronger with the actual sleep technologists more and more in the dentist's office. And what I'm excited to see is the advancement of the sleep technologists in the physicians as well as the dentist's office as a provider at the level of a provider and being able to provide care on the long term as opposed to just upfront.
If someone looking to become a sleep tech, what's the future on that profession?
Well, thank you for asking, Dr. Sokolina. Thank you for having us. The future of sleep technology couldn't be brighter. It's a field that's evolving, and it's an extension of both the dentist and the physician in the diagnosis and treatment of the patient. And the future involves educating, it involves coaching, it involves helping that patient achieve their health goals in a way that gives them a healthy and prosperous future.